Hello, everybody. Welcome to Liz Live. It is Friday, and I believe that we're on the 25th day of lockdown due to the coronavirus. And we have a very special guest today. We have Dr. John Metcalf, who is going to talk to us all about cannabis, medical cannabis, and how it could potentially be a treatment for the coronavirus. And right now, there's a big debate in the news media. What we're hearing is basically treatment versus vaccine as a way of dealing with the virus. And, all that we know so far is that a vaccine could take years. And so we don't know if that's something that's even a reality or that we can count on. So treatments are critical for us to discover. And I'm really excited to have Dr. Metcalf with us today to talk to us about something that we don't hear about in the news media at all. And I have lots of questions for Dr. Metcalf, and I'm sure all of you are going to have lots of questions for him as well. So let's welcome him. Welcome, Dr. Metcalf. Nice to see you.
Hey, good afternoon, Pittsburgh.
Good afternoon, and thank you so much for taking time out of your busy schedule to do the show today. And you're somebody that I consider somewhat of a mentor, and I'm always so interested in the things that you have to say. So let's just kick it off with, I think, the question that everybody has, which is, talk to us about how medical marijuana can potentially help a person who gets this terrible virus that's going around?
Well, I think that's an excellent question. The problem is I think it might be a little bit premature because we don't have a lot of research on it.
Okay.
About the coronavirus, I was just checking the latest statistics, and currently in the world we have 1.7 million people that have come down with coronavirus.
Wow.
97,000 people worldwide have died. Here in the United States, we have approximately 467,000 people that have tested positive for the coronavirus, and we currently have about 16,700 people that have died from the coronavirus. And obviously, we always hear this doom and gloom every day. It's very depressing for people. Take this moment to thank all our first responders, respiratory therapists, healthcare workers, our therapists, especially like you, Elizabeth, that does provide online services, because this is a time that when you listen to the news, we don't really talk about one of the most important aspects, which is mental health.
That's right.
I mean, we're always talking about the physical components. The virus has really put us into social isolation. And I've been spending a great deal of time researching the coronavirus and trying to find out any studies on medical marijuana. Now, some people out there in the field talk about the endocannabinoid system, which basically is a signaling system within our body that provides everything into balance based upon certain compounds that the body normally makes called endocannabinoids, which is basically anandamide and 2-AG. There are several other ones, but those are the two main ones. And how the phytocannabinoids, phyto being plant-based, THC and CBD from marijuana or medical cannabis, have been able to, in the world that we live in, it tends to make our immune systems and our other systems dysfunctional. And cannabis has been shown to at least help support trying to bring the body back into balance.
Okay.
And so I'm kind of curious too, Elizabeth, what you've had in your practice, what you've been hearing. We've had a lot more people call in with psychopathology, things like depression, stress, anxiety, PTSD, opiate use disorder. So these are really some concerns because we've noticed a sharp increase in conditions for mental health versus physical ailments, whereas before chronic pain was the number one cause. But I think anxiety is really pushing close based upon our certification and recertification of patients. How's it been for you?
For me, it's been quite an interesting month, to say the least, because so many of my clients are anxious as could be, and their anxiety is coming from a lot of different aspects. It's coming from just their own fear about, contracting the virus. It's coming from worrying about their elderly parents, their children, people with autoimmune deficiencies. So there's the health aspects that's creating a lot of anxiety. And then we have the financial piece, which is creating a lot of anxiety for people. I mean, especially, I know even for myself as small business owners, financially, this is a very scary time. And at least I'm still working. I mean, there's so many small businesses that have just been shut down. So then we have all the anxiety from the financial piece. And then, of course, the relational piece where, as you say, we're socially isolated from people that we love, that we want to see. And sometimes the anxiety comes from being stuck in the house with the same people. And it's just so much trauma. And I've been really trying to talk about thank you for asking, because I've been trying to advocate for the mental health aspects of this, and I'm hearing very little to none of it in the mainstream news media. And so I'm seeing the same thing that you're saying, for sure.
Well, yeah, I mean, you get on the news, and all they do is they talk about the doom and gloom. They talk about the numbers increasing. Maybe the curvature is slightly coming down. The emphasis is on secondary or tertiary care. In other words, vaccines that might be available in 12, 18, 24 months, different medications that might block the virus or the immune response to it. But one of the things that they really forget addressing has to do with the fact is that the mental health component, because when people are isolated, then they tend to be a lot more stressed. They release a lot of different chemicals and compounds like cortisol, epinephrine, which shifts us into the sympathetic nervous system, which is more the fear or flight. And people start to have more anxiety, more depression, inflammation in the brain starts to increase. So we're meant to be social creatures. So when we isolate ourselves, we affect our immune system. And immune system is really the basis of what the coronavirus pandemic is about. It's not the virus. The virus doesn't kill us, doesn't harm us. It's the body's response, the immune system's response to the virus that creates the pandemic. And when they talk about immune dysregulation, it seems to get underplayed by different medications, different vaccines that they're working on, when in fact it's this immune system that has become dysregulated that really causes a lot of these symptoms. One of my recent teachers, a PhD from MIT, Dr. Shiva Ayurveda Durre, I should say, he gave some excellent presentations about the immune dysregulation, about certain supplements that can build up the immune system, like vitamin D3, vitamin A, vitamin C, and also different iodine or iodide drops to help increase the thyroid functioning. And all of this really comes to the basis of the immune. If your immune system is dysregulated, then basically you're going to develop probably more severe, moderate to severe critical conditions of the coronavirus, which obviously leads on to possibly being intubated and put on a ventilator. And I think we need to shift a lot of the focus away from just fake news about the disparity. We should talk about more some positive things about what the communities are doing for one another, about the counseling, like for instance what you do, Elizabeth, to provide online counseling for people, that they're not alone. We're all in this together.
Right.
But I think the emphasis of the American Medical Association and other physicians has to be on lifestyle changes, including decreasing our stress, eating good food, drinking good water, breathing good air, also taking certain supplements that I just mentioned, some of those, exercising, being on, talking to our families, even though physically we might not be able to at the present time. And most important is restful sleep. If we can't sleep, then our body cannot repair itself. We get more inflammation. More inflammation can create more chronic diseases and makes us more susceptible to the coronavirus and what it does to the immune system, and dysregulates it, and we tend to go on a downhill path. So anything that we can do to address some of the primary education, primary treatment options, preventative, is really, I think, a key factor that we kind of lose track of.
That's right.
That's right. About pharmacology, we need to make a change on that.
Yeah.
Elizabeth, when you talk to your patients, what do you hear from them?
I'm hearing exactly, again, mirroring what you're saying, that they are feeling isolated, depressed, scared, anxious. And, one of the things that I've been trying to educate them on, and of course, you're much more qualified than I to talk about the immune system, but I always, tell people what I do, because I do, wrestle with some autoimmune issues, and I take everything that you mentioned. I take D3, I take vitamin C, I take iodine. I've been taking colloidal silver just for maintenance lately, and just anything I can to try to build up my immune system so that I don't get this, or if I do, God forbid, that I could handle it. So I'm trying to just share with people what I do and encourage them to do all of the things that you're talking about. But I'm wondering if you could talk, since you're really qualified to do so, if you could talk about the importance of supplementation right now, and maybe also how medical marijuana can be used in the prevention or treatment of coronavirus.
Sure. I think some of the big supplements are really important, is vitamin D3. There's over 87,000 papers on vitamin D3, vitamin D, on how it can affect the immune system, how it can also affect viruses from entering a cell, from replicating and being transported out of the cell to replicate with other cells. Also, like vitamin C, especially people that are in the ICU. Shanghai or China just has approved vitamin C for treatment for people with coronaviruses that are in the hospital.
Wow.
There's hundreds and hundreds of papers on vitamin C, especially high doses, like 50 to 100 grams over a 24-hour period.
Wow.
Because they can actually help block a virus from entering the cell, as well as the viral replication and what they call the cytokine storm. Let me just kind of backtrack with that.
Okay.
When a person is exposed to, let's say, the coronavirus, it enters in typically through the airways, and whether it's being through somebody sneezing or coughing or talking, some new research says that perhaps hypothetically we could do it from even breathing. That's why the change of mask, why people are wearing those.
Mm-hmm.
It goes down into the lungs, and it affects certain lung cells and creates an inflammatory process where the oxygen that we breathe to bring to our whole body to nourish it becomes compromised. And that's why people that have immune dysregulation have a higher probability that they're going to experience more severe episodes. There are certain blood tests that you can do, different testing. Right now, the CDC just approved over the next week or so to start doing serology, which is different antibodies to determine whether a person is infected or whether they perhaps build up an immunity based upon the IgG molecule, even though that is still a hypothesis that still has to be proven. People out there saying that once you get the virus, you can get it again. Well, we really have seen a couple of cases of that, but they're challenged in the literature.
Okay.
Whether that's really true. And testing, they basically still are using the real-time PCR, which determines, they take a small section of the coronavirus, they replicate it thousands and thousands fold, and then they determine through a scanner whether it's present or not. So there's a lot of different things. Plus, there's also the clinical, the most common symptoms that people have. 90% of people that have coronavirus have a fever greater than 99.2 degrees Fahrenheit. They might have a dry cough, about 70%, and 40% of people have fatigue. In addition to other possibilities such as runny nose, stomach problems, nausea, vomiting, change of appetite. So there's a lot of different things. There's some real interesting research coming out now that because the coronavirus affects a certain receptor on a cell,
okay,
it's called the ACE2 receptor.
Okay.
If the coronavirus attaches itself to that, then it injects its material into our cells and starts replicating. Now, the problem is that if we can block this with supplements and lifestyle changes, then there's a higher probability that people are going to have no symptoms or mild symptoms, just like children or people in their 20s or 30s, even though people can get it, because it has to do with their genetics and their lifestyles, the food they eat, the air they breathe, and the supplements that they take. Now, contrary to perhaps some local organizations who say that cannabis, especially CBD, which affects the immune system through the endocannabinoid system, has an effect that can positively affect and help modulate the coronavirus. Unfortunately, that we do not have the literature to support that, because there is one of my other teachers, a functional immunologist, Dr. Sam Yannick, on Cogent's immunology. He talked about the fact is that if you intervene too early with these anti-inflammatory supplements, then that could also affect the progress of the disease itself, because the body needs the inflammation initially in order to recognize the virus and to impose an immune response.
Okay.
And it possibly could be a more devastating disease for those people.
So
it's not all that simple.
So in other words, I just want to ask, because I'm getting a lot of questions from our viewers, but I wanted to ask the question. So there's been this big debate about Plaquenil and about, how it's working or not working, or safe or not safe. What are your thoughts on using, what you're just talking about is that if you give the anti-inflammatory too early, then, that the virus hasn't totally taken its full effects on the body, and so it could backfire somehow?
Yeah, this is all theoretical right now.
Okay.
What they say is, listen, if you're exposed to the virus goes in, attaches itself to the cell, and creates an inflammatory process.
Okay.
It is through the inflammation and the release of certain chemicals or compounds like cytokines.
Okay.
And other white cell, like the macrophages, the neutrophils, the dendritic cells, the T cells, the B cells, all of these are part of our immune system, which is a very complicated system from the innate to the adaptive, to the microbiome, to the neurological, that it's way beyond the scope of what I can talk about now. But the inflammatory process starts the process where the body recognizes the coronavirus and tries to mount a response in order to block it from entering the cells and from replicating.
Okay.
And that we're trying to do with supplements and lifestyle changes, and cannabis to some extent might have an effect, but we still have a lot more research to be done on that. Did I answer your question?
I believe you did. So when we're talking about medical cannabis, how would you recommend that we use it right now and prophylactically?
Well, again, this would be a theoretical because we really don't have the research to back that up.
Okay.
Cannabis has over 150 phytocannabinoids. It also has terpenes. Terpenes are like essential oils to give the the flavor and aroma. We also have antioxidants that give the cannabis color and also flavor as well. And all of these have amazing capabilities. Now, sometimes people say that cannabis might be more anti-inflammatory, but I think if you look at some of the new literature, it's more immunomodulating. In other words, it's kind of like an adaptogen. It comes in and it regulates the immune system. If it's overactive, it tries to calm it down. If it's underactive, it tries to bring it back up to normal. So we really just don't know. And the fact is, too, is that when we recommend a product, one product from one grower is so much different than the other growers. So, and when we don't really know all of the compounds and the products that we're doing, a lot of times the growers are marking down the phytocannabinoids, CBD, THC, CBG, CBN, and they also list some of the terpenes like myrcene and linalool. So this is all important, but there's hundreds and hundreds of other compounds within the cannabis plant itself that varies from region to region on how you grow it, that can have such a diverse effect. It's really hard to say. But if I had to guess, I typically educate patients and recommend they start on a tincture, or they start low.
And a tincture is oral. It's like a drop in the mouth, right?
Yeah, it can be alcohol-based or oil-based. You put it under your tongue for about 30 to 60 seconds. It's absorbed into the bloodstream.
Okay.
And typically anywhere between 18 to 33% of that is absorbed. And then what you swallow is absorbed through the GI tract. And by using a 1-to-1 ratio of CBD to THC, I think you're allowing your body, especially if your immune system is dysregulated, your endocannabinoid, hopefully it'll try to reset some of those receptors, and hopefully you'll be able to get a better response depending upon how you respond to that tincture. You might need more CBD, which is probably more for the inflammation, anxiety, nausea, vomiting, for neuroinflammation, for seizures. You know, there's a lot of different things that CBD can do that we're just beginning to touch the surface. So there's a lot more to learn and a lot more that's going to come down the pipeline. I try to educate people based upon evidence-based medicine, and I try not to give them a hypes because there's just too much to know, and every individual has their own unique biochemistry and responds differently to these compounds.
Right, and I think that that's something that's so important for all of us to keep in mind with whether we're talking about, you know, medical marijuana or any other kind of, you know, pharmaceutical, that it is relational, and we don't know how, you know, different people will respond to different things. But with medical marijuana, from what I know about it, is that there's so many different strains and strands and different combinations and the way that it's grown, that there should be something out there for almost everybody. I mean, is that fair to say?
Yeah, I would think so. I mean, I think the majority of people are going to have some response to it, but how it directly affects the coronavirus, we just don't know.
Right.
I know that they've had some interesting research on mice where they actually use THC, which is the psychoactive or the psychointoxication, or in the old days we used to call it getting stoned, that actually it made the influenza virus on the mice worse, including it downregulated the immune response to that. CBD, obviously, we don't have any viral studies on that, and even though we've been getting a lot of press about the Epidiolex, which is a CBD isolate, which is strictly 99% pure CBD for seizures in childhood. And again, I don't want to bring another topic. On Tuesday of this week, Charlotte Fiji, who was a 13-year-old girl who actually promoted the movement here in the United States about promoting medical marijuana, because she had failed all conventional treatment for her seizure disorder. And when she tried CBD, it actually reduced her seizures tremendously, and she was able to have a much more normal life.
Isn't that wonderful?
On Tuesday, she got the coronavirus, at least they hypothetically think that she did, and unfortunately passed away.
Oh, no. Oh.
She was such a beautiful child.
Oh, God, that's horrible. She was 13 years old and she died from coronavirus.
Right.
Oh, I'm so sorry.
We think it's the corona. She had the symptoms consistent with it. She was never tested. But that's really been a shock across the country because she was truly an icon, and she truly was a gifted, loving soul.
Oh, God, it's just heartbreaking, you know? And I think it goes back to, I know for me, it makes me really think about just how serious this really can be. It's something that, you know, we just don't, I guess maybe we just don't know about. And, you know, I know I'm the type of person where I like to be proactive and do anything I can, you know, to try to prevent something like this happening. And that's why I'm such a big believer in what you do. I'm getting some questions, so if it's okay, I'd like to hit some of these viewer questions that are coming in. Is that okay, Dr. Metcalf?
Absolutely.
Okay, so the first one is, Dr. Metcalf, can you tell me the difference between medical marijuana and CBD oil? I am having trouble sleeping and was thinking about using it, but I don't know much about it.
Well, I think they're referring to the fact is medical marijuana or medical cannabis actually comes from the cannabis sativa plant itself, which is marijuana, which typically has greater than 0.3% THC, whereas CBD oil, typically that you buy over the counter, comes from the hemp plant, which is a different species of the cannabis family.
Okay.
And it, by federal law, has to be less than 0.3% THC. And so with CBD oil, there's also full spectrum. There's also isolates where all you do is have CBD. But typically CBD tends to be more energetic, again, depending upon which other compounds like terpenes, essential oils that it's mixed with. So it depends upon what a person's is. But, you know, one of my my teachers too, who wrote the book Cannabis Pharmacy, Michael Backus, stated typically that 90% of people who take CBD, it tends to be more uplifting, more energetic, and probably less than 10% of people, it helps them to sleep at night. So you have to kind of be careful of that. Usually more of a THC, which is more sedating, along with terpenes like myrcene and linalool and beta-carotene. All of these can help calm a person down, whether you take a tincture or a capsule, depending upon which mode of administration that you do.
Okay, all right. Well, thank you for that question. Next one is it safe for children to take supplements?
Well, I think each individual kind of has to make that decision. I think given the fact is the world that we live in, the toxic environment, the GMO foods, the pesticides, the herbicides, all of these kind of deplete the nutrients that the body needs. So I think that multivitamin, fish oil, I think some of these things for children, I think is an excellent idea. Again, depending upon a person, how they're raised, lifestyle, whether they sleep, they play, they're active, their endocannabinoid system gets tuned up by the lifestyles that they live. So yeah, I think there is a place for that, but I think that has to be based on an individual child.
Okay. The next question is, how do I know if I am a good candidate for medical marijuana? That's a great question.
Well, I think the bottom line is first of all, you have to have one of the 23 qualifying conditions. You know, some of the top ones are chronic pain, inflammatory bowel disease, anxiety, depression, cancer, and the list goes on and on. So if you have questions specifically, feel free to give us a call at Medical Marijuana Specialists at 833-667-4665, and we'll gladly talk to you about the process, and we also give education. Before this coronavirus pandemic, I was out giving a lot of lectures, educating medical personnel and the public about what specifically it can do for you. One of our websites, which is www.getyouridcard.com, gives you lots of educational information. Some of my videos are on there. One of my teachers, Dr. Dustin Sulak, Dr. Sanjay Gupta from CNN, has an excellent website that we tell people about. We try to educate them because we hear too many often from our community and patients about physicians that are charging an extraordinary amount of money. They don't educate them. They leave them up to their own devices, trying to register with the state and paying the state registration fee of $50. We're a one-stop shop.
Mm-hmm.
I mean, we're here basically to work with patients, educate them, because this is not so much about the money. This is about a mission. This is what we do. We serve our community, just as you do, Elizabeth, helping people trying to, cope with the current stress and the environment that we live in. Because truly, this is a service for me. It's not about the money for me.
Right.
It's helping people. And I used to do functional medicine. Now I do strictly medical cannabis because I'm a patient. I've seen it help so many people, and there's just so much to learn. And it's such a privilege for me to actually be able to help patients with herbal preparation rather than give them a drug that only creates side effects. So if we can be obviously any a service to you, please give us a call because we're there for you, just like you are, Elizabeth.
Thank you. And I'll make sure that I post on my page today how everyone can get a hold of you. And I'm a big fan of Dr. Metcalf, and you and I have worked together for a couple of years now, referring back and forth, and everyone's always so happy with you. And you're known in the community as someone who really is passionate and really knows. You really know your stuff, and I know that you're 100% authentic and real, and we appreciate that. And I know I'm glad I have you to always call if I have any questions. And you also have a doctorate in psychology, isn't that correct?
Yes.
You just have a couple of doctorate degrees, no big deal, right?
Yeah, right. Yeah, I have a PhD in clinical psychology from Brigham Young University.
Unbelievable. So another question for you, and I know you have to go soon, but I just want to get a couple more things in before we let you go. This one question is, what one supplement would you recommend at this time? And I guess the viewers asking maybe in prevention of coronavirus. Is there one specific one that you would say, take it?
These are the top three that I would recommend. Vitamin D3, between 5,000 and 10,000 IUs a day. And that's predicated also about the fact that you can get a blood test to determine what your levels are.
Okay.
Another one is vitamin A, which also creates what they call a cytokeratin. A skeleton is kind of like a protective armor around our cells, and it helps the cell immune system. Because both vitamin A and vitamin D are actually hormones that affect our body. And vitamin A, I recommend vitamin A palmitate, about approximately 10 to 20,000 units a day for that. These are, again, for adults.
Okay.
Vitamin C, 1 to 2 grams a day. And obviously, healthy foods, exercise, the lifestyle changes that we met. But these are really important supplements. And also, there are some other supplements like astragalus, like berberine, that actually increase a certain part of our immune system called the Th1 response that actually attacks the viruses along with natural killer cells. And all of these are very important to augment our immune system and try to bring it back into balance, because that's really the true issue here. Not the virus, but how our body responds to it that's creating all of our problems nowadays.
That's right. Well said. Okay, final question for you, Dr. Metcalf, and then I'm going to ask you one or two before you leave. But this is our last one from the viewer is, if I decide to go with medical marijuana, what are the side effects?
Well, I think that's an excellent question.
It is a good question.
That's why I follow my teacher, Dr. Dustin Sulick's saying, start low and go slow. Now, if people start to vape or start to smoke cannabis, unfortunately, you cannot really measure the amount of milligrams that you're entering. And especially if it's high on THC, people can start having a paradoxical effect where they can start basically getting stoned, they're getting anxious, their heart rate increases, they get confused, they might pass out. So I'm just saying is that you need to become educated, and there's excellent websites that we recommend that educate you in the process, because in the final analysis is the education. That's what a physician has to do, is educate you. Mm-hmm. Don't listen to the guys with the white coats, everything that they say. Yes, they're good-hearted, but the bottom line is this is your body,
That's
this
right.
is your health, this is your journey. So let us help educate you, educate yourself. Give us a call. We'll do what we can for you. And again, be well and know that we care.
Thank you, Dr. Metcalf. So the one thing I just want to ask before, I know you have to go, but if we are to use medical marijuana, let's say we already have our medical marijuana cards, which many of my patients do, is there a suggested form of, like, instead of smoking, because I know what we're hearing on the news is that we don't want to smoke right now because that could potentially make you more vulnerable, I guess, either to the virus or fighting it if you would get it. So would you recommend, pills or tinctures? And I don't know if you can say this because it is so based on individual basis, but can you recommend like how much we should be taking using a day?
Well, I think it's kind of a hard question to address because everybody's biochemistry is different. For instance, there is kind of a movement called microdosing, which is usually less than about 5 or 10 milligrams. Starting low and go slow and try to work your way up to see what works best for you. Also, because cannabis has hundreds and hundreds of compounds, you kind of have to look at the whole thing, not just the coronavirus itself, but actually other conditions that you might have. Are you diabetic? Are you overweight? Do you have heart problems? Do you have lung problems? And again, true, as far as vaping, especially smoking, it can create irritation to the airways, and that irritation creates inflammation. And if the coronavirus is absorbed through the airway system, then you don't need anything additionally that could help augment the viruses getting into our cells and propagating and making the situation worse. So that's why I'm a big fan of tinctures under the tongue or possibly capsules and edibles to some extent, even though they're illegal, but people that buy cannabis can make their own edibles for their own personal use. There's topical salves, so each individual has to kind of determine what routes of administration, what their symptoms are. So you have to look at the person holistically, not just one symptom and treating that one symptom only.
Right. So, well, thank you so much, Dr. Metcalf. I love talking to you. I always learn so much every time we get to have a conversation. And I appreciate you taking the time to educate everyone who is watching today and who will probably continue to watch this over the weekend. And so if anybody wants to know how to get in touch with Dr. Metcalf, we're going to put that information up today. And you can also contact me and I can put you right into contact with Dr. Metcalf. And, well, I know you have to get back to your busy schedule, so I'm going to say goodbye to you, and then I'm just going to keep talking to the viewers about our conversation.
Great. I appreciate you inviting me. I appreciate helping our community and our patients. And remember, we're there for you. Have a great day.
Thank you. You too. Bye, Dr. Metcalf. Bye-bye. Okay. Well, that was a really informative conversation, and I'm wondering how you guys felt about it. Have you ever thought about medical marijuana before? And something that I have definitely done in my practice is, I always offer it up as a possibility for anxiety and PTSD. And it's something, and I've been lucky enough to have been mentored and to a large degree by Dr. Metcalf about medical marijuana for psychological issues. And one of the reasons that I love it for so many people is because one thing you learn when you become a therapist is that so many people have such a hard time with antidepressants and benzodiazepines. So let's talk a little bit about what those things are. So an antidepressant is a medication that in my field we use for people who are depressed, hence antidepressive medication. So when people come in, or now if they come to me via FaceTime or Skype or Zoom, however we're talking, and they seem to be a candidate for medication, which is again something that we can, through a consultation, decide what's the best route for you. But if you feel like therapy isn't enough, and there's certain reasons why sometimes therapy isn't enough, and so when therapy just alone can't do it, and we like to add some sort of medication, we look at antidepressants. And we look at benzodiazepines, which are essentially tranquilizers. They are things like Valium, Xanax, Ativan, all of those things. And I am not against benzodiazepines or antidepressants, but they tend to come along with some brutal side effects for many people. Some people will literally go through 10 different antidepressants before they can find one that works. And by that time, they've had so many other horrible symptoms from the antidepressants that they get discouraged and they wind up usually not taking anything. And so that is something that I see happen fairly frequently. And a lot of people just don't respond well to antidepressants. Some people do. So if you're a candidate for doing something beyond therapy, that is, again, something that if you call me, we can have a consultation, we can talk about that and try and see, what the best route for you would be. Now, up until really a year and a half, or almost maybe 2 years now, since medical marijuana has become legal in the state of Pennsylvania, I've now had a third option. Medical marijuana, from what I've seen in my practice, has really minimal side effects. And the reason it has minimal side effects is because if you take it, it's only really effective for a few hours and then it wears off. So the worst side effects you're going to get that I've seen, and again, I'm not a medical doctor, so I always have to preface everything I say with that when I'm talking about pharmaceuticals, is that people tend to get, if they use too much marijuana at one time, too much medical marijuana, they can get stoned, which some people enjoy that side effect, some people don't. But it's very scary for people who don't like it. And so when Dr. Metcalf is talking about microdosing with medical marijuana, what he's talking about is using a teeny tiny bit and seeing how you feel. And when you use that little tiny microdose portion of your medical marijuana product, if you start to feel like the reason you're taking it is dissipating, then you stop and you know that you've used enough. Instead of, just, dumping a bunch of medical marijuana pills or smoking, 20 hits off your pen. That is not therapeutic for using medical marijuana. And that's the one of the things that I think adds a big stigma to medical marijuana, because people tend to think that if you are using medical marijuana that you're just using a drug and you just want to be high. And that is not the case. Medical marijuana, the microdose movement and the idea behind using medical marijuana is just using a small amount until your symptoms dissipate. It's not about getting stoned. And unfortunately, medical marijuana has a pretty, unfortunate stigma, which I think is going away, that, it's just to get stoned. And that is not the case when it's used responsibly. So having medical marijuana as an option is wonderful, because generally you're not going to have withdrawal symptoms, and you're not going to, there's no risk of death that's ever been proven in any research for medical marijuana. So again, the worst thing that can happen is you might get too stoned, you might not like it because you've used too much, or you might, feel nothing and you think, well, this didn't work, or you might get a little anxious if you use certain strains, and the sativa strain of medical marijuana tends to make people anxious sometimes. So that's something that you want to consider if you're looking at medical marijuana as an option for depression, anxiety, PTSD. Benzodiazepines, which again are your tranquilizers, they are very effective and they work, but they also can create dependency, and they can be very addictive very quickly. So even if you're just using it to go to sleep at night, and you're not even using it during the day, you still can get hooked on it, not in a negative way and not in a destructive, addictive way, but you can still your body can get so used to it that you will never be able to sleep without it, and it's very hard to wean yourself off of it. So those are the different issues with the different treatments for things like depression and anxiety. And depression and anxiety tend to really go hand in hand. So if you are very, very anxious all the time and you're having panic attacks all the time, then you're going to probably become depressed as a result of that anxiety. And sometimes if you're very, very depressed about your life or the things that are going on, you will tend to become very anxious and anticipating the worst. And so you'll find that anxiety and depression are not necessarily mutually exclusive, that a lot of times they are just very much attached. So in a time like this, where, as Dr. Metcalf was talking about earlier, where things have changed for all of us, and if you watched my show on Monday, the whole show was talking about how I think people are really traumatized from what's happening right now, then you would understand why medical marijuana could potentially be an option for you at this time. So let me check out the screen and see what kind of questions are going on. Where do you begin with medical marijuana? Can you use it instead of antidepressants? Yes, you absolutely can use medical marijuana instead of antidepressants. Many people, as I was saying earlier, do much better with medical marijuana than antidepressants. The problem with antidepressants is that a lot of times, well, not a lot of times, there is no way for us in psychiatry, psychology, counseling, there's no way that we can determine which neurotransmitters in your brain are deficient. And so we can never know exactly which antidepressant to give you. We have to listen to the patient and listen to what their symptoms are and try to, take as much information from the patient as possible to determine what might be the best antidepressant for them based on age, based on personality, based on history, based on circumstances, psychosocial factors. But we can't, it's not an exact science. It's not like we can test for strep throat and give you penicillin. So psychiatry and antidepressants in general are somewhat of a crapshoot. So we don't know. So we have to play a guessing game. And a lot of times people don't respond well. Whereas with medical marijuana, any side effects you have from medical marijuana are probably going to go away within a few hours. Where on antidepressants, it could be weeks and months of a lot of discomfort. But again, some people respond very well to them and some people don't. Can you become addicted to medical marijuana? That's a very good question, and it's very debatable. There's not an exact answer for that. Some people in my field believe that anything is addictive, that, marijuana can be as addictive as anything else. However, there's no scientific proof that there's any real withdrawal symptoms that are experienced for people who smoke all the time and then don't smoke, biologically speaking. But there is some evidence that anything you do habitually can be psychologically addictive. So are you going to go through the withdrawal symptoms if you are trying to get off marijuana that you're going to go through from heroin or opiates or benzodiazepines? No way. Nothing like that. You don't get dope sick or anything, like that. But if you're misusing marijuana and you're, using it several times a day, it's hard to say. I mean, couldn't that mean psychological addiction? So there's a big debate in my field about that, but great question. Okay, is medical marijuana expensive? Will my insurance cover medical marijuana? Right now in the state of Pennsylvania, insurance does not cover any medical marijuana treatment at all. And I really hope that changes someday, and I'm sure that it will. But as of right now, it's all cash. So when you go to see Dr. Metcalf, you do have to pay him for that visit, and you do have to pay the state of Pennsylvania $50 a year to maintain your medical marijuana card. And if you don't already have medical records that prove that you have a qualifying condition from a psychologist, a counselor, a medical doctor, if you don't already have that diagnosis somewhere in a medical record that you can give to Dr. Metcalf, then you would have to go see somebody to get a diagnosis for one of those 23 qualifying conditions in the state of PA. So there are, I've worked with many people lately who, would like to try medical marijuana for depression, anxiety, PTSD, but they've never been to a counselor before and they've never been evaluated. So they'll call me, and through a series of sessions, I will evaluate them and, determine whether or not they have a diagnosis of PTSD and anxiety. And if they do, then I can, hand them, a piece of paper that, talks about the evaluation and send that off to Dr. Metcalf. And in the state of Pennsylvania, the person who is diagnosing you with a qualifying condition cannot certify you as a medical marijuana patient. So there's a couple of steps that you have to go through in order to become a medical marijuana patient in Pennsylvania. And again, the step one would be if you don't have medical records showing that you are diagnosed with one of the 23 pre-existing, qualifying conditions, then you would need to go to the appropriate health professional and get that diagnosis. Once you get the diagnosis, then you can call Dr. Metcalf. Dr. Metcalf can then see you, and now I know he's doing telemedicine, so you can do it through a video call, and he can then look at the records, discuss your condition with you, and then make the recommendations from there and certify you as a medical marijuana patient. Once you get your medical marijuana card in the mail and you go to a dispensary in your area, you have to meet with, the first time you go to a medical marijuana dispensary, you have to meet with a pharmacist. And I highly recommend doing that because the pharmacists there are really well educated, generally speaking, in medical marijuana. They know what products would be appropriate for what your particular condition would be. And they're just a wealth of information, at least where I've gone. I know that the Healing Center in Monroeville is the only dispensary that I'm really familiar with, and I know that they do a wonderful job over there. So I hope that that answers those questions. How do I handle drug testing in the workplace if I decided to take marijuana? Well, this is another difficult question to answer. There's a lot, because this is kind of new in Pennsylvania, I don't have a blanket answer for you. You always want to check with your employers, read the policies, find out what your company says about it before you do anything. I mean, that's just my recommendation. I also recommend that you talk to Dr. Metcalf about that, because he and his staff are, really knowledgeable about these issues, and they can really, put you in the right direction with this topic, because I get this question all the time, and I usually defer to Dr. Metcalf. But you always want to ask and find out what the policies are. And I've heard different things, that if you are drug tested, and don't quote me on this because I know these laws tend to change, but if your company drug tests you and you have a medical marijuana card in your particular state, supposedly if you give at the lab, if you give them the medical marijuana patient card, they're not supposed to test you for marijuana in that specific drug test, but they can still test you for all the other drugs that they're looking for. So it's a tough question, and because medical marijuana laws vary from state to state, and I know people are watching this from a lot of different states, you really want to make sure that you cover all your bases, and you can always refer to your state medical marijuana websites. So you can go to the Pennsylvania. I also refer a lot of people to go to the Pennsylvania Department of Health. They have a lot of information about medical marijuana on their websites, and I'm sure all the states where it's legal medically would have that same information. So you do need to advocate for yourself, make sure you have all your bases covered, and consult your certifying physician about all of these questions that you have, that they're really, really great questions. As an employer, what is your opinion on employees that test positive for marijuana? Should it be accepted or disqualify a candidate from employment? Hi, Zarel. This is a tricky question to answer. I can give you my personal opinion, which, for what it's worth, is what it's worth. So, for me personally, I've never been super, conservative or concerned about marijuana use. But so if I found out that one of my if I found out that one of my employees, used marijuana recreationally, or if they had a medical marijuana card, I wouldn't care at all. If they use it recreationally, I would say as long as it didn't impact their job, and it didn't impact their lives to the point where they were dysfunctional or hurting themselves, I probably wouldn't be too concerned about that. But I think a lot of it depends on what are they doing, what kind of job are they doing? Are they using dangerous equipment? Is it life and death? Are they dealing with people's health? Are they officers of the law? I mean, I think certain professions, you just want to be, really clear-headed and sober for. I think any medication can run the risk of having side effects that could interfere with your job performance. So, I mean, this is a tough question to answer, and I'm thinking that I think it would depend on a case-by-case basis. Definitely. I mean, if you're doing something that if you have a desk job and you're sitting at a desk and you're entering data or something, and you're doing a good job, who cares if you smoke? But if you're dealing with something that's a life a life and death situation, then I might be more careful about that. So Dr. Metcalf's nurse, Shelley. Hi, Shelley. As an employer, Act 16 states that an employer cannot discriminate upon hire or otherwise discharge a medical marijuana patient. But again, it is up to each individual employer. So yeah, thank you, Shelley, for that information. It's such a provocative topic, because on Act 16 is saying that employee cannot discriminate upon hire or otherwise discharge a medical marijuana patient, but then it's still up to the individual employer. So what supersedes the subject? Is it the employer or is it the law? Like employee policy or law? I don't know. It's such a provocative topic. Darrell asks again, can I be discretionary and treat it on a case-by-case basis, or does that open me up for a discrimination lawsuit? Now, Darrell, I think you're in the state of Maryland, if I'm not mistaken. So, I would probably consult medical marijuana professionals in your state, because Shelley and Dr. Metcalf are from Pennsylvania, and we don't really know what the law would say in Maryland. So I think that would be a question that you would definitely want to, and Shelley's saying I would reach out to an employment lawyer. Yeah, I would too, Darrell. I think that these are such good questions. I wish I could fully answer them, but I can't. There's so many angles and sides to all these questions that I just, but great. You're welcome. Thank you for asking them. So I hope, I'm trying to make sure I didn't miss anybody's question, but are there health risks associated with medical marijuana? Not that I know of, but I do think it depends on who you ask. And I think that that's probably a question suited best for Dr. Metcalf, and but that I personally know of. I think the risks are more associated with how you're intaking it. So I think if you're smoking marijuana, that's probably very different than if you're using an edible or a pill or something, because then you're getting into the lung issue. But that would probably be a great question for Dr. Metcalf. So if he comes back, I'll make sure we ask him that. Can you drive while on medical marijuana? Shelley, if you're watching, I think can you answer that? I think no, but I'm not sure. Shelley, we have to be cautious so Shelley's saying to the question about are there risks for people who are using medical marijuana, and that is we have to be cautious and folks on Coumadin, and Coumadin is a blood thinner. So I did not know that. Thank you, Shelley. And Shelley, if you know anything about driving on medical marijuana, if you would type that on the screen, because I'm not sure about that question. I know that when you leave the dispensary gives you a special bag to put your products in, and I believe you're supposed to put it in the trunk when you're driving or something like that. But these are really good questions for that I cannot answer exactly. That Dr. Metcalf hopefully will weigh in on this, and then I can respond to your questions later on my Facebook page as well, because these are all such great questions that deserve a good answer. But from a mental health counselor standpoint, I really do believe that medical marijuana is a great option for anxiety, for PTSD. Depression is not on the qualifying conditions list, just anxiety, PTSD, and I believe Asperger's, and then of course opiate addiction. So those are the medical, those are the psychiatric qualifying conditions, and I've seen great things happen with people with all of those 4 diagnoses using medical marijuana. I think medical marijuana is a very safe and predictable substance to use for mental health issues. Again, if you don't like the way it makes you feel, you're done with it. It's over in a couple hours. But if you're taking antidepressants and you have a bad reaction, it could take you weeks or months to feel normal again. So I think that, these are things that you have to talk through with me. And if you're coming to me for anxiety and depression and PTSD, these are things that we would discuss in a consultation and really what is the best route for you. But I thank you guys all so much for these wonderful questions. This was such an interesting show. And, we're going to be back here on Monday. Okay, wait a second. We're getting some information from Dr. Metcalf's office. Medication must be transported in its original packaging with the receipt and placed in your glove box or trunk. It is not allowed to cross state lines. It is also illegal to smoke marijuana. It is legal to vape it in a special vaping device. Okay? So I'm going to repeat that for anyone interested. Medication must be transported in its original packaging with the receipt and placed in your glove box or trunk, and is not allowed to cross state lines. It is also illegal to smoke marijuana, but it is legal to vape it in a special vaping device. Thank you, Shelly. Thank you, Shelly. I was close. I didn't have it exact, but I was pretty close. So again, I will put on my Facebook page how to reach Dr. Metcalf and Shelly. And of course, if you are not diagnosed with any qualifying condition, specifically anxiety, PTSD, Asperger's, and opiate addiction, you can call me and I can consult with you and we can talk through what it would look like to choose medical marijuana as, your way of, dealing with your particular issues. I have seen it do wonderful things for people, and I will rebuke the stigma about it. I've just seen great things happen, and I do believe it's a great option for people. So if you're interested and you are not diagnosed with PTSD, anxiety, Asperger's, opiate addiction, you can call me and set up a session. We can talk through it. We can consult and decide, if it's a good option. And then, of course, I can pass you along to Dr. Metcalf. Thank you guys so much for watching. Next week, we have some really exciting shows. Monday, we're going to be talking about the latest issues in the news and the mental health implications of that. Wednesday, we're doing a political show, and we're having Doc Shirey come back on to talk about politics. And Friday, who knows what's going to happen on Friday, because we don't know what's happening in the news, but I will be here talking about mental health and trying to be there as a resource for all of you during this time. And yes, we passionately believe in the healing properties of plant. Me too, Shelly. Please don't hesitate to contact me if you need more information. Have a safe weekend, everybody. Thank you for watching. You're watching Liz Live on Facebook, and I will see you back here on Monday.